everyone, my name is PHROCLORPERAZINE, and throughout this video you are going to learn more information about me. So, to formally introduce myself, I am again PHROCLORPERAZINE, that's my generic name. For my brand name, I am Compazin, Compro, Compazin Spansul, Ametil, and Melatil, and this is my chemical name. Under the drug classification, therapeutically, I am an anti-emetic agent and antipsychotic. Pharmacologically, I am phenothiazine. And in the pregnancy category, I belong to pregnancy category C. For the mechanism of action, PHROCLORPERAZINE basically block D2 dopamine receptors in the brain. We may also block histaminergic, cholinergic, and noradrenergic receptors. Inhibition of D2 receptor signaling results in the postsynaptic dopamine receptor in mesolimbic system 11 and increased dopamine turnover. Nausea and vomiting are suggested to arise from peripheral or central stimulation of serotonin type 3 or the 5-HT3 and dopamine type 2 receptors, the predominant chemoreceptor trigger zone receptor or the C2Z. PHROCLORPERAZINE have anti-emetic effects, hence the anti-emetic agent, and has been shown to inhibit apomorphine-induced vomiting by blocking the D2 dopamine receptors in the C2Z. In the pharmacokinetics, in absorption, we are well absorbed from the GI tract. The onset of pharmacological action is approximately 30 to 40 minutes after oral administration and 10 to 20 minutes after intramuscular administration. Distribution. We are distributed to most body tissues with high concentrations distributed in the liver and spleen. We undergo hepatic metabolism, which involves oxidation, demethylation, sulfoxide formation, and conjugation with glucuronic acid. The route of elimination for us is via feces or bile, and the half-life for intravenous administration is 9 hours, and for oral administration is 8 hours. Medications. We are recommended for the treatment of severe nausea and vomiting, including that specifically associated with anesthesia. We are also indicated for the management of manifestations of psychotic disorders such as schizophrenia and generalized non-psychotic anxiety. In general, our use for generalized non-psychotic anxiety is not a first-line therapy and should be limited to doses of less than 20 mg per day or less than 12 weeks. Off-label uses include use in adult and pediatric migraine emergency situations. The American Headache Society recommends our use as a first-line drug in this setting. In pediatric migraines, non-steroidal anti-inflammatory agents are often used in combination with dopamine antagonists. Our contraindications include severe hypotension or hypertension and severe liver dysfunction, which might interfere with the metabolism of the drug. Caution should be used in individuals with renal dysfunction, moderate liver impairment, active peptic ulcer, or during pregnancy and lactation because of the potential for adverse effects on the fetus or baby. In general, antiemetics like us should not be used in patients with coma or severe CNS depression or those who have experienced brain damage or injury because of the risk of further CNS depression. For the side and adverse effects. In the central nervous system, we have neuroleptic malignant syndrome, extrapyramidal reactions, sedation, and tardive dyskinesia. For the eyes, ears, nose, and throat, blurred vision, dry eyes, and lens opacities. Cardiovascular system, ECG changes, hypotension, and tachycardia. Endocrine system, we have galactorrhea. In the integumentary system, we have photosensitivity, pigment changes, rashes, and hives. Digestive system, constipation, dry mouth, anorexia, drug-induced hepatitis, and ileus. For the muscular system, we have muscle stiffness, and the urinary system, pink or reddish-brown discoloration in urine and urinary retention. Lastly, for the nursing responsibilities of the nurse in handling the drug. So prior to drug administration, the nurse must educate the patient about the medication, instruct patient to report any adverse reactions, assess the patient for possible contraindications. During the drug administration, when administering through the nasal route, instruct the patient to blow nose gently to clear nasal passages before administering the medication. For instillation drops, tilt the patient's head back while sitting or standing up, or hang head over the side of the bed when laying down. Stay in the same position for a few minutes to spread the medication through the nose. For nasal sprays, position the patient's head upright, then spritz 1 to 2 sprays firmly to each nostril. Wait for 3 to 5 minutes, instruct the patient to blow his nose, and repeat the dose. Rinse the tips or droppers of nasal solution dispensers with hot water to prevent contamination of the solution. For oral medications, give as directed on the label or as prescribed by a physician. Warn the patient not to use in larger doses, especially when taking OTC medications, since OTC medications contain the same ingredient, which could possibly lead to overdose. And after drug administration, evaluate the effectiveness of the drug therapy, monitor breathing patterns and observe for shortness of breath as phenylephrine may trigger asthma, monitor changes in the heart rate and rhythm, elevated temperature, behavioral changes, and chest pain closely for patients with diabetes and hyperthyroidism. And lastly, for hypotensive patients, monitor vital signs, including cardiac output.